So I think we'll get started. So welcome everyone. This is the School of Public Health annual regular noon talk, which is being hosted by the Division of Environmental Health. And I'm Professor Andrea Rother. I'm the head of the Environmental Health Division. And we are very honored that we have Michelle McLean. Are you actually a professor as well? Yes, sorry. I just realized you.
I was the youngest at you placed it in the form of 40.
There you go. So Michelle has done her some of her work at UK ZN in biological sciences, and then she worked at the Nelson Mandela School of Medicine for 19 years. And was involved in curriculum development in 2001 when it moved into a more traditional problem-based learning. And then she took up a position in the United Emirates. Yeah, and in 2005 because of her PBL experience. And then after 5.5 years, very specific, was offered a skills migration visa to become the small group learning lead at Bond University in the Gold Coast, Australia. And that's where you are at the moment, yeah. So she was Associate Dean and has had various portfolios and is now responsible for the integration of planetary health into the medical program, which we are desperately trying to do here, plus runs a planetary health master's subject and has other expertise across the faculty. So we're very privileged to have you. Thanks. And we're looking forward to hearing what you have to say.
Thanks for putting up with me. I have a fair few slides.
Good.
But hopefully we'll get through them. If not, they are available. And I'm going to try and convince you that it's a planetary health that you need to look at in terms of the curriculum, not just sustainable healthcare or climate change. We've got much bigger problems than both of those. A little bit about me already. So I'm from UKZN. I did all my degrees there. And while I was at the med school, I was involved with SAHI, which is around the corner here happening. And in fact, I was the secretary at one point when we had a Durban meeting. Moved on to the United Arab Emirates, where I went into medical education. And then the next colleague was in Bond and said, hey, there's a job here for you, apply, and I came across on a skilled migration. So why does Australia need someone who's not Australian and over 50 essentially? I had to answer to that. I grew up in KwaZulu-Natal, and these are the pictures. You'll recognise some of them: the Drakensberg, the Fluey. I'm an outdoorsy person connected to the land and country. Transkei Heights, Vetchies Pier, underwater hockey. Represented South Africa, so I'm a water baby. I got gold medal in Canada for the Masters side. Played squash, still play squash, B League. I was also involved as the chairman of the UKZN or the KZN recycling forum, the chairman of the Durban branch of WESA. So the natural environment's in my blood. I kind of grew up with it. So I thought I'd just start to just say this is the key principles that are embedded in our planetary health program at Bond in the medical program. Planetary health applied through an Indigenous lens, and I'll explain all of these as we go through. We extend Bond's global citizen graduate to planetary citizenship and planetary stewardship. We embrace the United Nations Sustainable Development Goals. Bond signed up in 2019, and so we're supposed to be putting them on all through our operations and research and our teaching. And we've adopted an eco-biopsychosocial approach to health and well-being, so extended the biopsychosocial because of the environmental determinants of health being so important. And we value eco-ethical leadership for a just and sustainable future for all of the planet's beings, not just for humans. Just to give you a little bit of background why, before I start on some other things, the Stockholm Declaration of 1972 already recognised that the environment was in strife all those years ago, and that we need to protect the resources of the earth so that there would be future generations able to enjoy that. In Principle 4 says that man, and I suppose woman, has a special responsibility to safeguard and wisely manage the heritage of wildlife and habitat because it's already imperiled. So that was already back in 72. And then 50 years later, the Stockholm, this is the Stockholm report, and they provided this kind of summary. If you go onto the website, it kind of builds it up, and it's a really interesting way to look at it. But those three spheres are important because they'll come back to that economy, society, and biosphere. And you can see how everything is woven through in different ways. But the most important thing is looking at, here's Indigenous local knowledge, animal welfare, nature in urban areas, rights of nature, nature-based education, valuing nature, sustainable lifestyles, all the things that we talk about that we need to be able to do are embedded in there. I'll just take a little history back and go back for the Ottawa Health Promotion Charter of '86, and it was already talking about ecology as being an essential issue and looking at a socio-ecological approach to health and to take care of each other, our communities, and our natural environment. So it's all, all these documents tell us we have to be looking after our environment. On the 28th of July 22, the UN declared the healthy environment a human right, so a clean, healthy, and sustainable environment. And later that year, the key outcomes agreed at the UN Biodiversity Conference in Montreal spoke about the 30 by 30. So we have to be protecting 30% of our land and water by 2030, and also looking for $30 billion to help developing countries to do this. And then also last year in April, the climate change threatens the rights of children, and the UN had outlined how states need to protect children as the future generations for climate change, and it's based on this healthy environment as a human right. So I look at it from the perspective of the triple planetary crises, as I call them. UN talks about triple planetary crises. There are three of them: climate change, which we all know about; biodiversity loss, which is super important, also linked to changing climate; and then a pollution-free planet as well. So we're sitting at a time of these triple planetary crises and needing to address all of them, and they're all interrelated in some way. So conceptualizing planetary health, it means different things to different people, and some people will just talk about it as planetary health. Planetary is the adjective and health is the noun, so it's a healthy planet, right? Planetary health. But for me, it's much more than that. And I wrote this little article this year to try and conceptualize it for people, because there are different ways of looking at it. And it's only 1,000 words. It's quite hard for me to put things into 1,000 words. But this is what I did. I kind of looked at it in three major ways of looking at planetary health. Is you can take the very anthropocentric lens, which is it's all about humans. So you need a healthy planet to have healthy humans. And everything you do is for humans, essentially, within those limits. Then you can take the Planetary Health Alliance framework, which fits into education quite nicely, where it's centered on this interconnection with nature. So this is where some of the Indigenous principles come in. Here are all the changes that we've made to the planet, anthropogenic changes to the planet. And then we work within that multi-systems thinking and equity and justice and so on, that then feed into this once we have this connection with nature. So it's inclusive, restorative, and nature focused. And then, remember I said that at Bond we do an Indigenous perspective. And this is Nicole Redvers, who's a Dani First Nation person from the Arctic Circle. And I connected with her when we wrote some papers. I was looking after a special issue of Medical Teacher in 2020, sort of around COVID times. And she said, it's a field that's primarily, planetary health is a field that's primarily a Western construct, as Indigenous traditional systems have no clear separation between the community and the ecosystem. And this is this little diagram on the bottom of my screen, bottom left. So I don't know which side to be on that one.
That one.
Also bottom left. It's that's kind of like you merged with, you're one with nature, you're part of the ecosystem, you're not outside it. And that's where the ecological versus the egological concept comes in. So you're an ecological balance with nature, and you look after your custodians. And this little, the one at the top is how she's conceptualized it with those first laws of nature, and that then informs. Sorry, that useless. Yeah, and I'll just use it. Yeah, and this
We can't see it when you use
No,
it,
right.
but they can on that.
yeah, then this one you can see this. Can you see that?
And now we can.
Yeah. So and then so all the indigenous knowledges or traditional ways of knowing, being, and doing are in with those first laws or natural laws. That's what governs everything, and so it works from there. And a very useful one for us is this national strategic framework for indigenous people, so Aboriginal and Torres Strait Islander folk, where the self is in the centre. And when you look at all the connections for self, so your self-identity depends on your connection to country, connection and with connection in land, and for other people, but in Australia they talk about connection to country, which has spirituality, connection to spirituality, family, community, all sorts of things. And so for self to be whole, you have to have all those spiritual connections, and that's why taking people or country is discombobulating them. They lose their identity. So that's a really important concept, which we'll look at later. So back to the biomedical program. I got there in end of 2011, so it technically started working in 2012, whole new curriculum. There was very little public health in the curriculum, very little global health. It was a borrowed curriculum, we had to rewrite it. So I introduced a public health workshop in 2013, which was run by an evidence-based practice clinical researcher who happened to be South African. He did his PhD at Oxford, but he went to Michael House in Durban, so we had some connections there. And then in 2016, put a climate change focus to it. And in 2019, this was replaced with something called key concepts in public health, global health, and planetary health. So looking at all the indices, how we measure health in various contexts. And in 2015, I introduced a global parasitology conference with teams and posters, and we put rosettes on, and they won, and they had new presentations. And this has now become a planetary health assignment with team presentations. And I'll talk about this later because this is the research that you asked for. We've published on that one. And this is where the spiral for planetary health is currently in the biomedical program. We have a 4.5-year degree. We have trimesters, so we hamsters in a wheel. We just keep going. I've just finished the second semester. I go back and it's the third trimester. It starts on the 6th of September. So year one is 6 months, and all the basic stuff is in there. You can see the intro to planetary health, the biopsychosocial model, those key concepts, and we do some health promotion. And you'll see a little bit later that we still have this planetary health lens to it. And I also do, we've got incredible donations of First Nation art in the faculty. And that's country, it's all country, it represents country people's connection and spirituality. And so I do that art tour, and it's linked to a cultural immersion, but it's part of the planetary health. Year two is we have a scenario for small group learning that is where some students go to the Solomon Islands, and that becomes kind of the global health. And then we've got 2 assignments, both of which are planetary health and health promotion. Health, so the first was health promotion about exercise and sustainable active transport and sustainable eating. The SDG assignment is the one we just finished, which is a planetary health one. I'll explain that in the results for lived without study. And then I do justice, ecological, planetary, and earth system justice. And then a workshop, a 2-hour workshop on hope at a time of triple planetary crises, because eco and climate anxiety are particularly high amongst young people. And so we have to still have that hope. If there is no hope, then, it's just, what are we going to do? So we all got to get moving and take action. And then year 3 and 4, it's some of it's mainly environmentally sustainable healthcare. some of the, in year 5, I run a master's subject in Master of Healthcare Innovation, and I have MD students who choose that as the option. So I had nine MD students just finish doing that planetary health subject, and then in GP we do environmentally sustainable healthcare. So the slide is going to kind of talk about how I got to planetary health. Sort of the journey that I took, that it's not just about sustainable healthcare. So as I said, we know about climate change has been around for a long time. Costello and his colleagues in the Lancet in 2009 wrote about climate change as the biggest global health threat of the 21st century. And at that time, they said it's going to undo 50 years of work that has been done in terms of health gains. 2014 came the From Public to Planetary Health Manifesto from Horton and his colleagues in the Lancet, and saying that public health needs to expand and become planetary health. And then, of course, we had the Paris Agreement with all the key elements of addressing climate change. Try to keep temperature below 1.5, 2 degrees, but preferably 1.5. Have these country checks every 5 years, and to provide finance for developing countries so that they don't have to go through the whole trajectory of fossil fuels that we went through. A landmark paper in the Lancet of 2017. This diagram summarizes quite a lot. There's a lot you can get from here. All the underlying drivers, like the demographic shifts and the overconsumption and technology, that is the major causes. A lot, all our actions here, and the ecological drivers, and then all the way sort of down. This is where we're ending up with malnutrition, infectious disease, non-communicable disease, displacement, mental health. So that's a really nice sound paper to look at. We then had Frumkin and Haynes talking about global environmental changes, showing how these are all interconnected: the biodiversity loss, urbanization, chemicals in the environment, food and nutrition, and air pollution, climate change, all sort of linked. And then in 2019, so this is just kind of, I guess, on the cusp of COVID, this paper by Prescott and Logan and Katz, we argue that in 2019, one simply cannot claim to be a healthcare professional without advocating forcefully for the planet. And in early 2020, Margot Parks and her colleagues spoke about an eco-social approach to public health. And this quote is from that paper. It says, health professionals will be called on to engage as humble, informed and trusted partners in a collective boundary crossing effort of transforming practices and structures to better sustain the health and well-being for all life on Earth, including our own. So much more, not just humans, it's all life on Earth. So the biodiversity side of it coming in. Then, many of us are familiar with the Healthcare Without Harm and ARUP's 2019 healthcare climate footprint, and the Director General of the WHO talking about the health sector as doing harm to people and harm to the environment through its actions. So they do no harm, it's actually doing harm. And then, of course, me being in Australia, and seeing Australia sitting here, it's not number one, those are just alphabetical order, but it's in the top 4 for big per capita polluters or emissions, because it's such a wasteful system. And 7% of the country's emissions are from healthcare, and it's gone up obviously from COVID, add another 1% to that. And then, because Australia hadn't done much, the trajectory was going to have to be very steep to bring it down. So I'm in a perfect environment to be looking at that. And then going back to the WHO, talking of in 2017, defined an environmentally sustainable health system as one that improves, maintains, and restores health while minimizing the negative impacts on the environment and leveraging opportunities to restore and improve it for the benefit of health and well-being of current and future generations. And I read this as leverage opportunities to restore and improve it, meaning the environment. So there's a restoration concept there for me. And we then go think about what's been happening in the UK with the NHS, and they had a Climate Act in 2008, and they've really moved ahead in terms of reducing their environmental footprint, not environmental footprint, but their emissions in the NHS, and they were in that 2019 report, they were about 4%, and the global average was 4.4%. So they had done a lot of work in the Sustainable Development Unit. And they have the Health and Care Act now that came into effect in 22 that's need to address climate change at the same time as just thinking about reducing emissions, so environmentally sustainable healthcare. So during COVID, while we had nothing else to do, right, lockdown in the home or in your office, we, I don't know how I got into it, but I ended up being a guest editor of a special issue of Medical Teacher with Judy McKim and Trevor Gibbs, who worked here, right? At some point, he was head of medical education, and I was still in South Africa. And these are some of the key papers that came from this. There were 8 invited papers. So our one, the editorial was educating for planetary health and environmentally sustainable healthcare, responding with urgency, because we're on this trajectory. We needed to do something. But other key papers were on the side here. They came from the students, Omnia El-Amrani. She was the first for the COP conferences, the one that was in Sharm el-Sheikh. She's an Egyptian. She was the first youth envoy in the year before last. What are we now, 24, 22, in 22, she was the first youth envoy, and she's now at Imperial College London, I think, doing a master's there, and still very active in this space, mainly with children's rights and climate change and all that sort of stuff. So that, and this is their work for the International Federation of Medical Students. Found out that worked out that only 15% of curricula had anything about climate change, and only 11% of curricula had anything to do with air pollution. So virtually nothing, and the whole world was surveyed, and lots of students and former medical schools surveyed. Faculty development in partnership with students to integrate sustainable healthcare into health professions education. This came from Senya May Tun, so from the UK, and they were still talking about sustainable healthcare, and we're really talking about planetary health there. And I got the students to talk about planetary health. And then Nicole Ravers on the Indigenous perspectives on education for sustainable healthcare. I put her in touch with a colleague in the office next to me, Clinton Schultz. He's a Gamilaroi man from down south in New South Wales, and also connected to country. And so that's those were like key papers for me. Well, this was kind of happening. We start getting reports like this that talk about the human mass, all the plastics that we've created. 8 tons compared with the biomass that animals live on Earth, 4 tons. So we have twice as much plastic as there are living biomass. And then the buildings that we have now weigh more than the greener trees, the plants and the shrubs, which is quite scary. You can see how this mass has just increased here. This is 2020, so imagine what it's like now. And then, of course, COVID did come and smack us. And what came out with the talk was it was because of our broken relationship with nature that we needed to mend it. So if you think that it came from the wet market in Wuhan as opposed to the lab in Wuhan, either way, it's fiddling with nature, right? All these animals that are brought together that shouldn't be together, and so you get these zoonotic transfers. And so this little cartoon here, if you can't read it there, it says the city with COVID saying, all we have to do is wash our hands and all will be well. And we're sitting with recession, climate change, biodiversity collapse. What's not there is the pollution side of things, not just the air pollution, but all the chemical pollution. And then this was the UN Environments Program. We've got to make peace with nature. We have to repair that broken relationship, because we're just treating nature as a commodity and just selling and literally raping nature for our own benefit. This is a 2020 bending the curve of biodiversity loss. If business as usual, this is where we're going to end up. we can conserve some things, this is what's going to happen, but we have to do much more than that. We have to have the circular economy, more sustainable production, less consumption, if we have to have that biodiversity. Around that same time, this Living Planet report was released, and it's a very bleak picture. The Living Planet index decreased, our vertebrates under populations have declined by 50%, 58% between 1970 and 2012. And then you can see what is threatening those populations. And it's mainly overexploitation and habitat loss. And the pollution is down here, invasive species here, and climate change is starting to impact us. So this is like around 2020. But all of it is us, right? It's humans doing this. And in 2021 came out this devastating Australian State of the Environment report of just how many animals are endangered and have become extinct and are on that list. And this little cartoon shows some of these endangered animals phoning up Extinction Rebellion and saying, you've just got a bunch of new recruits. We've got the eastern quoll, we've got the koala, the eastern curlew, this is a numbat here. This is an echidna. We've got a red-ruffed parrot and night parrot. And so the animals are going, help, we're in strife here. And this little piece that I put here came with this, and it says Australia's past is key to a better future. The oldest living culture in the world, the Australian Aboriginal and Torres Strait Islander cultures, know that if you take care of country, it'll take care of you. And so moving forward, we need to be working have that two-eyed seeing, so that we do things the way the custodianship and stewardship of land that was practiced for 65,000 years. And then this is a recent one in June this year, but the site that went like that. It says, if the land is sick, so are we. And it explains that connection to country and that spirituality of Australia's First Nation people. Some of the other things that that came out during COVID is the eco-ethical leaders that we need to sort things out. And I know we should have put we put a more sustainable world in the future, and we should have added just to that. The AMI consensus statement, which was it's really been highly cited. So many people are using it because we provided the learning objectives and activities and assessments and so on. And so just keeps on being used. And then I published this one with a whole lot of my colleagues with some examples about what we're doing in this space. And most importantly, it was recognizing the environment as a determinant of health. And you'll see that how that becomes important in this discussion. This comes from the AMI consensus statement, where Sarah Walpole, it was with Sarah, myself, and on there. Sure. And we were looking after the whole lot of collating it, and so kind of put this together. And I'm still kind of going. We still got. It says planetary health and sustainable healthcare. Because I hadn't quite conceptualized what I meant by what does this planetary health mean. Nicole was there, and so it was this Indigenous perspective that was coming through. So it was kind of starting to crystallize for me, and we could see Indigenous peoples incorporate this knowledge and values for centuries, and so we kind of got it in there. But this was my epiphany, this paper during COVID, from Nicole Redvers and Clinton Schultz, my colleague again, wrote this, and it just tells stories of how the natural things, how they live connected to country and to the land. It was I recommend reading it if you really want to understand an Indigenous perspective. And note that this Beshad London, she is the elder. So in Indigenous cultures, the elders have to approve what it has said. What you're going to say. And they wanted to have Mother Earth as their first author. And the journal goes, what do you mean by that? And that's all they would allow them to do, is formally acknowledge Mother Earth as our senior Earth author with her own presence and voice. And there's so much talking about these first or natural laws. And just to put it into perspective, Indigenous stewardship is key to global conservation goals. Indigenous people are protecting biodiversity one harvest at a time. And this little statistic map shows what it's all about. So Indigenous people of the world make up 6% of the global population. They account for about 17% of the poor, the really poor people of the world. They look after 22% of our land and water, and 80% of the remaining biodiversity of the world exists on that 22%. So I go, who do you think should be looking after the land? Indigenous people. We all know about COP20 that got postponed from 20 to 21. And so in September came this call, 200 health journals, all the editors published the same thing. Emergency acts to limit global temperature increases, restore biodiversity and protect health. And then for the first time, the climate, the argument for health came into the COP conferences. So this was the special report. And this is my favorite one, protect and restore nature is the foundation of our health. And we can see others, the sustainable and resilient food systems, all the things we know we should be doing in the climate, but number 7 is where I'm heading, keeping the nature story. At the end of 2021 came the Geneva Charter for Wellbeing, and this was very much about making peace with nature, planetary well-being, and so on. So kind of all going into that idea of the healthy planet, that we need to look after it. And at the same time, the UN has declared the decade of restoration, so 2021 to 2030. And this was preventing, halting, and reversing the degradation of ecosystems worldwide. And so it's this moving into reconnecting with nature, making sure that we steward it. And so in terms of the bond curriculum, this is where I kind of conceptualized it, and looking at planetary health through an Indigenous lens, and look at public health, global health, One Health, eco health would be in there, sustainable healthcare would be in here, and planetary health is that big umbrella. And that's how I ended up getting to that particular point. So I'm going to I'm just looking at time because it's 45 minutes. There's a whole planetary stewards. We have to, this is an important one, we have to break free from this tunnel vision of carbon emissions. Because once if we just hook on carbon emissions, we forget about all the other things that are going wrong. And we've crossed 6 of the 9 planetary boundaries. So and the novel entities are all the things we've made, the plastics and the chemicals and the forever chemicals, the PFASs and so on. So planetary health pledge. This is something that health professionals can do. If I was the dean of my faculty, I would not do the Hippocratic Oath. I would do the planetary health pledge, because it talks about all life on Earth, right? No plants, no animals, no humans. So we have to look after them. And planetary health being the new standard. These are SDGs that we embrace. We can look at them in very different ways. The problem with SDGs is that they're based on a very weak model of sustainability. It's called the triple bottom line. And we've been operating here, society and economy, and forgetting about the environment. When you put it in a strong sustainability model with the environment on the outside, so all the ecological, environmental determinants of health, we have a much stronger sustainability model. And this is, it looks like this, which is called the wedding cake model of the SDGs from the Stockholm Institute. And so that's how it moved from the biopsychosocial to an eco-biopsychosocial approach of well-being. So your first determinant of health is actually the environment. That was used also. It was a settlement map for cities, but you can see the global ecosystem, biodiversity, climate stability, and the next level is still environment. It's the natural environment. So the big planetary ones, and then you come down to the local. A lot of nature prescription happening at the moment, recognizing that our mental health is instead of prescribing Ritalin and antidepressants. Let's go out there and let's reconnect with nature and let's restore nature to restore ourselves. Sort of doing that. Promoting the trends, we're ending the trends to promote health and well-being. There's a big wedge of ecology here. You can see climate change, environmental changes, and so on. This is taken from that. This is the medical paradigm which we're in should be decreasing, and the planetary health paradigm should be increasing. And then this also from that, again, that shows what the medical paradigm is, the one where we access care, you know, you're sick, let's sort it out. And then it goes through preventative health promotion and One Health to planetary well-being. So we use this with the students. This is what I use for planetary justice. It talks about a justice beyond national borders, justice across generations, because whatever we do now, someone else is paying for it down the track, just like the youngsters today. You know, from my generation, which is the what do you call them? It's lost on me. I'm the one who's one of the polluters, right? I'm just on the edge, but that's where the wealth sits with our generation who use lots and lots of resources, the baby boomer generation. And then justice for non-humans. So all things have a right to be here. This is an example of what we did. So 2018, I put in this planetary health assignment. You can see that it meets a whole lot of our learning outcomes. So HS is health and society, PL is leadership and professionalism, and scholar and scientist. It was based on SDG 13, and the students had to choose another SDG. They submitted a proposal with a message. They wanted to provide a message to be delivered to somebody so that some behaviour would change or action would be taken. And this is the sort of stuff they took over the 5 years. We can see that waste was a big issue, pollution was an issue, and then this was about poor health, addressing poor health. And their second SDG was SDG 12, which is sustainable consumption production, SDG 11, which is sustainable cities, and SDG 6, which is about water and sanitation. And when we look at over 5 years overall, the audience was something to government, telling government to take action, health professionals, getting them more involved, and that was much about sustainable healthcare. Public was about action to address climate change, and also the university. And then we also looked at the product format, videos, pamphlets, written proposals. And as we come to 22, you can see more websites sort of creeping in here. So it became much more technical as opposed to kind of written stuff. And then this talks about their values, behaviours and attitudes. We had a little poll when they were voting at their presentations, and the impact, they all agreed that it really did, this assignment did develop their skills, but also made them more aware of their role. These are some of the examples. Got the greenhouse emissions, the footprint of anaesthetic gases, a whole proposal to the minister, which we sent to him, Minister of Health, about the impact of climate change and dengue in Queensland. Using the planetary health diet, a poster for doctors that help the students guide to healthy advice for our planet. Green points, how students could be involved in environmental restoration and earn green points, which we put into the curriculum. They could do stuff on campus and off campus and earn some points, which they did. We changed the assignment to well-being at the request of the students, and we addressed SDG 3, the well-being mental health side. And again, you can see 11, 12, 13 was climate action is their second one, and then environmental life above land was another one. And most of it was directed at the university, but mainly the students, because it was around the mental health side of things. And then this was this year's. We made it health and well-being for all of the planet's inhabitants. And these are the two winners. Clean Catch, it's a website, and EcoFlow is a website. And theirs was about salmon farming in Tasmania. which is causing such environmental hazards. Animals are being killed, like shot, seals are being shot. And they did a little skit here, plenty of antibiotics in the environment, and the mackerel are full of antibiotics. So people are eating mackerel with antibiotics coming from the salmon farms. And this little skit, he's pouring a bucket of antibiotics. Here, I have some antibiotics over the fish. And this one is about using waste to clothing that could no longer be worn, materials to make eco-friendly sanitary pads, you know, that would be washed. So period positive, waste negative. And there were 2 guys on that team. It wasn't just women, which was super good. And we, what we do with the students, we have the academics choice. We vote for who we think the markers, vote for who they would like to as the winner, and it comes up in who's first and second. And after the pictures of this 10 team that present, the students then vote for the people's choice. And we then donate to an environmental organisation of their choice to make them aware that we need to think past feed the babies. We need to think about the environment as well. So I think I'm going to stop there. There's a lot more, but I'll stop there and see if anybody's got any questions.
Gosh, there's a lot of things to thought there. Thanks a lot, Michelle. Any questions in the room? And any questions online? We've got 2 online already. Shall I go for online while you 2 think about it? Nandi?
Yes, hi. Thank you, Michelle. Nandi Siegfried from the South African Medical Research Council. Really fantastic summary of progress to date and very well done on all the educational side of things. And I know James Earlham has been spearheading it here at UCT. But I wanted to ask you perhaps to comment or provide any thinking you might have. We at the MRC have applied a carbon tracking tool. And as you say, overfixation on carbon is in and of itself an issue. But using a tool developed in the UK from the Sustainable Healthcare Coalition, which recognizes that clinical trials are a part of that 4.4% greenhouse gas emitting from the healthcare sector. And really the intention of these tracking tools is to make you think already at protocol stage about where you can mitigate, where you can reduce. And obviously there's a huge diversity across IMP, investigational medicinal product trials compared to behavioral trials, compared to health systems trials. But I just wanted to know if you had any thoughts about the clinical research environment and thinking that through in terms of the eco-biopsychosocial model, which is a really great thing to have been introduced to. Thank you.
Yes, I'm sorry we lost you for a lot of the time.
Oh dear. Must I repeat?
Oh gosh, we
can other people hear me?
Ask the question. Ask the question.
Okay, could other people hear me? Can any one of the participants say if they heard me? Otherwise, I'll type it out in the chat.
I heard you.
I could hear you.
But I'm in South Africa.
Right,
No,
so there might be a problem on your side. I don't know. Okay, I'll type in the chat.
It is.
You can repeat your question. We have enough time, and then Michelle can respond to it.
Okay, I'll start again then. Michelle, I don't know how much you got. Can you hear me now?
We can hear you, yes.
Great. So I thought it was a really terrific presentation. And I wanted to ask if you could comment, and perhaps from the Australian perspective, about any progress that you're aware of or has been made in the clinical research space. Here at the South African Medical Research Council, we are in the process of applying carbon tracking tools to our clinical research, our clinical trials in particular. And I note what you said about the overemphasis on carbon being a bit of a, like not the full picture, but I do think it gives one a start. particularly when you are developing your research projects, and to think about where you can mitigate and reduce in the trial space. And I was just wondering what your thoughts were around clinical research, which is also a very important contributor to the healthcare emissions.
Absolutely. Let me show you. I'm just going to go to the end. This one. This is so this could be, if you're looking beyond carbon. And I use this as a healthcare for the planetary injustice session. So we look at, I told you we have different kinds of justices, and this is the planetary injustice. And this was published late last year. And so they've moved past carbon. They're looking at the biodiversity impact of healthcare. So they're trying to, and it's called the extinction footprint. So all the actions, the activities that happen in healthcare, where is the, what is happening? So in this slide here, so it's a structural analysis, and they talk about 5 orders. The first order, here's the patient accessing healthcare. These are all this is all the supply chain. So this is, say, in the Netherlands. What they worked out was the Netherlands has the biggest footprint in a couple of ways. So they decided to unpack what the extinction extinction coefficient was, or whatever it was, what I'd say, the extinction risk footprint of the Dutch healthcare system. So you be a patient, get something, there's glass that's needed for the tests that come from Belgium. Belgium gets the knives, the diamond knives from the Democratic Republic of Congo. So that's where the footprint is going to happen, and then it's on the animals. So when they unpacked all of this, this is what they found in the Dutch healthcare system, looking at the cost and so the intermediate cost and then the footprint. This is where the biggest footprint was. So even though cost was low, this is all the regular activities that happen in healthcare down here, relatively low footprint. The biggest footprint was from the food and beverage and agriculture that happens in healthcare. So keeping people in hospital and feeding them this food. And when they sort of unpacked all of this, and this is what they ended up with. There are 10 fifth order supply chains in the Dutch healthcare system. And so there's 1, 2, 3, 4, 5 looking at it. So healthcare, commodity sector, healthcare industry, this is the food and beverage industry, and it came all the way down to the agriculture. So the 10 top ones are all about agriculture. So where they were sourcing food, Madagascar, Guatemala, Ghana, Tanzania, Ethiopia, Honduras, Costa Rica, Sri Lanka, the CMR is Cameroon, and back to Madagascar. 1.57%, 1.5% of that footprint, the extinction footprint, is coming from agricultural products sourced from Madagascar. Like an island with high biodiversity. And they then worked out that all at the species level, 4,769 threatened or near threatened species from 250 countries are impacted by consumption products and services provided by the healthcare. So there's no carbon here, right? This is all about the impact of the resources that the healthcare system uses that is now impacting animals, and they haven't even done plants. And that you've got 10 endangered animals here. Red colobus, white-thighed colobus, rollaway monkey, white-necked mangler. And this is, a lot of it is, when they work it out, it's actually from the cocoa. The cocoa that they use in the healthcare system, $830 million of cocoa sourced from Cote d'Ivoire. And it was now impacted because you've not got to knock down the forest to grow the cocoa trees. So there's the habitat gone. So that just puts it into perspective how much it's not just carbon, it's not just greenhouse gases.
Do you want to come back to that?
Yeah, I mean, that's really helpful, but I'm very interested in the clinical research contributions, because we have to do, it's problematic.
It's all your supply chains. Where do you get your supply chains? So you have different ways of measuring it, and this is one example of how you measure it.
So while you ponder that, we'll go on to Nisha's question, and then in the interest of time. Nisha, do you want to ask your question?
Great. Thanks, Andrea. Thanks very much, Michelle, for a great presentation. It was really interesting. So I'm here at UCT and I chair the undergraduate committee. So looking at training medical students. Can you hear me?
Yeah.
Okay. So I just wanted to know how you dealt with concerns around medical curricula being or health sciences curricula in general being very overloaded and having limited time to incorporate planetary health. And then attached to that question, I think the field of planetary health is moving very rapidly. And, where one says this over focus on emissions, etc., have our sort of clinical educators caught up with that changing terminology, the changing field, and because when we expect to enhance our curricula, we first need to ensure that those working in the field actually understand all the different aspects of planetary health and how it impacts. And I feel that a lot of the time when we engage with a lot of clinical educators, they're not aware of how the field has progressed, and we're looking at One Health and we're looking at planetary health, etc., where they might still only be aware of climate change and emissions, and how do we actually impact the educators before we move into the curricula. So yeah, two related questions. Thank you.
So I just want to say that our advocacy, so we worked through the medical deans of Australia, a group of us who were, I say we were the eco-ethical leaders and driving it. And initially it was climate change. And I kept on saying that it's got to be more than climate change. It's got to be more than climate change, right? And you can see that it is much more than climate change. But we the Australian Medical Council, and these outcomes are freely available. If you go onto the website, you'll be able to see our accreditation criteria. We worked to get the stuff into the accreditation documents. So here is an example. We've got 4 domains: science and scholarship, planetary health sciences is in there, and the definition they give is the WICME one, but that's fine. At least it's in there. Professionalism and leadership. Demonstrate understanding the ethical dimension of medical practice, explain ethical frameworks in decision making, do no harm. Non-maleficence, do no harm. Apply legal responsibilities in limiting human rights-based approach to health. Clean, sustainable environment is a human right. It fits exactly in there. The Torres Strait Islanders have taken Australia and won their case in the Human Rights Commission around Australia's high footprint and not doing anything about climate change. They're waiting now for the local court to talk about what is going to happen. The Torres Strait Islanders of Australia, and they sued their own government in the international court and won over climate change. And it's a human rights issue. I'll just show you a few more. Here we got identify the social, cultural, personal, environmental determinants of health for health and society. Here's health promotion approaches. So just take the WHO, bending the curve, put it in there. That one. Aboriginal and Torres Strait Islander, there are 15 of about 60, 70 learning outcomes relating to Aboriginal and Torres Strait Islander health. And it's all around their well-being. There's the Indigenous lens that I use. So I've integrated, apart from in the beginning, where you can put the intro, what is planetary health, why do we do it, what is happening. Here we subscribe to the eco-biopsychosocial approach. The rest of it is taking what we have and modify, saying we're now looking at it through a different lens. We're not doing the same old disease-oriented one. We're doing it through an Indigenous lens, and we're looking at this connection to country and reconnecting with nature. So it was to describe global health issues in terms of health and disease. Hey, planetary health is a huge global issue, and the relevance to Australia and New Zealand, because New Zealand fits fall under here, so Aotearoa, New Zealand, the broader Western Pacific, all our Pacific neighbours are going under, sea water levels rising. We've already got going to offer Tuvalu 500 climate migration visas a year. And that Tuvalu is going into the metaverse, so that in 20 years when it doesn't exist, people can still connect with their culture. So it's right on our doorstep. So we have to do stuff, these things. And then in clinical practice, as a practitioner, it's all around taking a patient history, providing culturally safe care. You've got to know that person is connected to country, environmental lifestyle features, sustainability of investigations when they're prescribing or ordering investigations. That's a sustainable healthcare one. It has cultural, spiritual needs and a geographic location. I can't tell you how many submissions we made to this and the reviews, and we've got it in there. So that's but now it has to be done. We have to report on this after 6 months. So July, the report went in. Everybody had 6 months to do stuff. Because I've been working on this, we were miles ahead of everybody else. And we had some workshops and what have you. But in many instances, students are more skilled and more advanced. So work with your students. That's one of the principles that we've suggested. Work with the students. If we go back here, this is a really good, and James used this one. James, you did the Planetary Health Report card, did you? Yeah, okay. And I managed to get this one in to Planetary Health Report card. To what extent does your medical school emphasize the importance of Indigenous knowledge and value systems as essential components of planetary health solutions? So a lot of advocacy on, either individually or collectively to get things moving in Australia.
Nisha, do you want to come back on that, or does that answer both your questions?
That's great. Thank you very much for those insights. That's very helpful. And I think a lot of people are asking if the slides could be shared, and that would also be fantastic. Thank you.
Yeah, happy for you to use that.
The slides will be shared. There will be a recording, and we've got 1 minute left. So I've got 2 more questions. So James, did you want to make a comment before we go to Nasiko?
Well, just to say thank you so much, Michelle, for a terrific presentation. Again, I'm so sorry I can't be there to engage further. Just one quick question, perhaps, is whether other health professions have been included in the Bond University program. To what extent are the opportunities for the medical and other health profession students to work together on this?
So like anything, you need allies and collaborators. And I've been fortunate to have someone in nutrition and dietetics, and they have, and nutrition and dietetics will have it in their program. It's slow, to get learning outcomes or accreditation documents are super slow. It takes a long time to change. And so because this was happening, we just jumped in and got our stuff in. But nutrition and dietetics is on its way. And the OT, they had a 2018 document called the World Federation for OT, and it was around sustainability in your scholarship, in learning and teaching, and in your personal life. It's a really good document. And so one of the authors is at Bond, and she has the next set of accreditation documents from OT will have all of this written into it. So it's slowly happening. I do a 4-hour planetary health workshop in OT, and then I just keep sending stuff to other people around, that is of interest to them. So they're all their accreditation documents. The next iteration will certainly have some form of either sustainability or planetary health or as One Health or whatever. Like the vets are really good with One Health, makes sense for vets because of that intersection, that particular intersection, but that fits under the big planetary health umbrella.
Thank you for that. Nasiko,
Wonderful, thank you.
Yes, I had a question, and thank you for the presentation. Coming from a developing country context, I'll just use maternal mortality as an example. You find that the major determinant in a lot of studies for Africa mostly, is distance to the health facility. So a lot of countries now are taking healthcare, maternal care, very close to the communities. And because they're doing that, that means the healthcare waste that comes with all that is getting closer to the communities as well.
Yeah.
So you were talking about the triple bottom line and the different choices that have to be made. So I'm thinking as devil's advocate, how much are we involving the engineering profession, for example, in coming up with technology that will still give us improved health outcomes, but at the same time, reducing the harm that healthcare is causing to communities?
Yeah, so like all the PPE, for instance.
Incinerators.
Yeah.
I'm thinking about things like we want to go towards non-burning technologies, for
Yeah.
example. But then in a small health post in a rural area, it's not possible for them to have an autoclave.
Yeah, yeah.
So what options are we giving those kind of healthcare systems that are right in the communities? Their main determinant is really just to save lives. So this for them is
Yeah.
yeah.
So I know, so there's an organization in the UK called Revolution Zero, and they're looking at PPE that's much more environmentally friendly. I have a colleague in Australia. He's currently a GP, but he was also a surgeon and also a psychiatrist, but GP's now where he sits. He is hemp, looking at hemp as a material, and that would be biodegradable. Yes, you know, because it's plant material. And he thinks it's actually going to be bought out by somebody who's it's at the testing stage now. So how many times can you use it before it becomes contaminated? It's a hard one when you when you can't do it. The only way is to take whatever it is to take it out. If it's mobile clinics, to take it out. But to try and find alternatives, there's also a cost, right? And I went to India with some students a couple of years, actually 2019. We got back before COVID as well, and we went to it's called the Bansali Trust run an eye camp, and they do thousands of operations over a month, and they have autoclaves. They don't have any disposable. All the instruments are autoclaved. So if it is possible, like running with solar, small autoclave, it's probably the best way to do it at the moment. But yeah, I understand your dilemma.
Thanks. So I'm going to close the session, but we will continue the discussion over lunch.
Can I say that anybody can email me? I don't think I put my email there, but just look up Bond University and look for my name. McLean, Michelle. Happy to chat to anybody and provide any resources that they might need.
Great, and thank you very much for coming to visit us. I know it was a short visit, so thank you.
So I just it's the Ministry of Planetary Health.
Great.
As an evangelist.
Right. Instead of the Ministry of the Future. Yeah. Thanks everyone online. The slides will be available. I'll ask Carmen to distribute them, and also it's recorded. Thanks and have a good day everyone.